I've got you in big field of view now, Laura.
Likewise. It's almost like being across from a desk.
Yes, yeah.
You look really well, Chris.
Thank you. Yes, I am. It's the lockdown haircut.
Yeah, tell me about it.
So when you first started working in genetics, what was it like?
So I started working in genetics just after Our Inheritance, Our Future paper.
Okay.
In fact, that came out just as I was training. And so I think there was a lot of excitement when I first started off that there was a bit of a new chapter in genetic counselling, that we were going to have some new training and lots of new people entering the profession. And it felt like the first of a first investment, I guess, like a big investment within the profession.
Mm.
But it was also a very different time than it is now, in that we had a difference in workforce, that we had probably training more people than there were permanent jobs at that point.
Okay, yeah.
So when I came out of my training, there was quite a scramble for jobs, whereas there's a real difference now in that there's many jobs than there are genetic counsellors around to fill them. And that gave it kind of a different feel. From a clinical point of view, so my first job was obviously in Birmingham. It was a cancer-only job in a cancer team that was 3 people, which is really hard to believe now. The amount of people that are doing cancer within large centres like ours is enormous, and there's a huge amount more work, as you know, Chris, in cancer genetics. But the majority of it was sort of single gene predictive testing and diagnostic testing. So quite a far cry from the panels and the genomes and the exomes that we're doing these days.
Yeah, yeah. And so for you, who were the important genetic well, not important, but who were the influential, shall I say, or meaningful genetic counsellors to you on an individual level as well?
Apart from yourself?
Yeah, apart from me.
So I guess early on, because I trained in Manchester, it was a lot of Manchester genetic counsellors that were involved in our training. So Lauren particularly, but also Tara and Georgie and Rona and Diana, who were all involved in a lot of our training, a lot of guiding the profession at that point. Once I came to my first full role in Birmingham, Mandy Barry joined shortly after I did, and she was quite influential as my first manager in the department, in terms of the way that genetics works. And then some of the clinicians as well, some of the medics, so Trevor Cole and Cyril Chapman, particularly having worked initially just within cancer, in the way that they viewed genetic counsellors and consultant geneticists working together, and the way that the role developed, were really important in giving us a lot of autonomy and allowing the genetic counsellor role to develop really within cancer genetics.
Yeah, that's, I don't think that should be forgotten, how much our profession developed on those medics with a vision to see what the future team working might look like. Yeah.
And a very mutual respect, you know, and collaboration, you know, that was really important, and probably a large part of what kept me enthused in the role was being able to have that autonomy and being able to stretch things a little bit.
Yeah. So you came out of the master's course. You weren't a nurse.
No, master's. Yeah.
Did it feel at that time though that the master's, that was a sort of regular entry route by the time you joined?
Yeah, I think it did. Yeah, I think it did. So I graduated in 2005. So they had been going for quite a long time. Both Cardiff and Manchester were pretty established by the point at which I graduated from my master's. And although in Birmingham at that time, there were a good handful of us that had come out of master's routes, it was still quite a nursing entry genetic counselling team at that stage. And probably continued to be so, more so than some of the other teams in the country for a while afterwards. But there was still a good cohort of us that had come out of the master's route. And so we had quite a nice balance going on between the two.
Yeah. What can you sort of pinpoint any really the sort of important turning? You've already said about the white paper. Any important turning points in the development of genetic counselling?
Oh gosh. So I guess there's turning points in terms of clinically, and then there's turning points in terms of kind of professionally. And for me, kind of later on, a kind of big turning point came when we started to lose the white paper funding, actually, and the training posts that we'd had through that white paper, and needed to introduce a different sort of training. When the STP training programme came in, that really felt like things had taken just a slightly different direction. From my perspective, as AGNC chair at that time and being quite involved with that STP training, it felt like a really positive move. It felt really interesting in terms of our allegiance with science as well as with counselling. And it felt really important that we got back our funded training that we'd lost, because that really narrowed the people that we could bring into the profession to those people that could afford to pay for it, which doesn't feel quite right, and particularly from the point of view of diversity isn't really what you want in a profession. You want to be able to attract lots of different people. So that felt like it was very important, but also it perhaps this wasn't totally intentional, but it's sort of taken us on a slightly different route in terms of the way registration works as well, because it brings in a different cohort of people that have got registration in a slightly different way. And I think that brings along with it. So it might not have deliberately felt like we meant it to be a turning point, but actually in hindsight, it feels like it's been a key moment in the length of career that I've had so far in the profession.
Yeah. It's really interesting. It's just a personal reflection on time. That all seems so recent to me. It's TV. It seems, and I think that's why I'm so interested in doing this, talking to people, because that feels like it's like those sort of diagrams of the evolution of the Earth and how long man's been on it. It feels like it's this little tiny weeny bit at the end, really important. But I suppose that reflects where I am in my working life and where you are.
And it is recent, isn't it? It's only 5 years. Still early days to know where it's going to go. And I suppose it's interesting for me that since then we've now started to think about apprenticeships and entering clinical scientists in genomic counselling through that route. And so sort of building on this slight diversion that has been taken, another different way to try and get more genetic counsellors into the profession. I'm interested, I wonder whether those people who were around when the MSc started feel like it's very similar, that it's just another branch that's been introduced.
Yes. I don't know. I think when the MSc started, it was much more tied. There was a lot of anxiety about as a health professional, you have a sort of professional home. And so I think for some nurses, that was really challenging to be expected to join a different professional home. So it felt like it didn't feel like an evolution. I think it felt like a complete revolution, in some ways, for some people. Something completely new and out of their expectation. Whereas I think my impression is the STP training program is about a little bit more aligned. The difference is the registration. The difference is not so much the profession, as it were, because we'd established. I mean, that would be my feeling. We'd established the profession, or more or less.
Perhaps it gives a foundation where once you've come through it once and you've brought in some people of a slightly different training and background, you know that you can do it again, but you've all got the same set of values and the same practice.
Yes.
You've come from different places to get to that point.
I think that also reflects the partnership working we did in the that very, very quick piece of work in working to get the curriculum down. I mean, because you were an integral part of that, weren't you? As part of, was that because you were on the AGNC, or were you just?
It was because of being AGNC chair at the point at which we started the training, and so that meant that I then chaired the curriculum development group. There was around 8 or 10 of us involved in that. making sure that we got the curriculum right, that we got a good
Yes.
balance of the science and the counselling and the psychosocial all in there, and not losing anything, but also a chance to revive it a bit, I guess, and bring it a bit modernised, a little bit more up to date, reflect kind of what we thought future practice was going to be, as much as anyone can predict. So yeah, that felt like a real interesting kind of turning point. And then I guess clinically, the introduction of all the genomics that's come through, the introduction of genomes and exomes and even panels to a degree, feels very much like it's been quite a key turning point. So my background's in research. Before I came to genetic counselling, I did a PhD in cancer research. And cancer science is something I've done a lot of, if you like, in my previous training. And I always remember back in 25 years ago when I started my degree, how excited we were about the idea that at some point we'd be able to work out what the genetic fingerprint of the cancer was and therefore tailor treatment towards it. Like that was a thread that was running all the way through my research career before I came into genetic counselling. But it always was talked about as, well, one day we'll be able to do this. And so it's really interesting from that perspective to actually see clinically some of that happening now in actual practice. Because it to some degree, it felt like something that was way in the future that we kind of couldn't predict, and actually to see it and be working on it clinically is really exciting.
Yes. Yeah. And to see that where the research is going. There's so many unanswered questions still, but the research, we're just finding out more and more. It is amazing, absolutely amazing. And whether one, there's all the arguments about whether genomes are useful in somatic genetics or not, but need the knowledge to generate the evidence.
Yeah. But it also means that some of the things that we thought were relatively simplistic, there'll be 7 changes in each cancer that are key that we can tackle. And now you look at it and there's hundreds and thousands. We pick out the important ones, the way that it has evolved and the new knowledge that it's brought by understanding it a little bit more is it's really interesting. And to think that that's starting to affect treatment and hopefully at some point outcomes then. To see. I think that curriculum group was, because we had the framework we had to work to, quite a confining framework. But I think, again, the theme that's coming through talking with people is it's individual people that sit down and engage with it that get it done. So that group of 8 or 10 people hadn't made the time to work under considerable pressure to make that framework fit with a sort of broad consensus of what genetic counselling in the UK was. It could have been very different. And it's astounding that people find the time, because it's obviously that it's the people with the knowledge and the experience that you want sat around the table. They're also the busiest people who have got so much going on, and yet they all give considerable time and energy to sitting through what do we already know, what have we already got from the competencies for the GCRB, what's already there in training, what do we want to retain and what do we want to develop further, and really give it some real hard thinking. What was a very short space of time actually come up with the curriculum. So they were a fantastic group to put the energy into it. To some degree, having that really confined amount of time probably helped us.
Wasted a lot of time, did we? Arguing.
Absolutely. Very, very much focused you, didn't it?
Yeah, it did. And we worked, I think we worked very well at thinking about what battles we wanted to fight, what were the really important non-negotiables, but what actually were, some people weren't that happy with, but we could let go, like genetic and using genomic instead of genetic, but keeping counselling. And I think that's continued to some extent because we were piggybacking onto an existing training program. We had to work within the constraints of that training program and the structure that already existed, as you remember. And some of that's worked really well, actually, and other parts of it, 3 years, 4 years on, we know still aren't ideal. Some of the assessments, for example, they're very laboratory kind of focused. Even though there are other scientific programs
within the clinical scientist route that are patient facing, actually for some of it, the focus is much more on a laboratory environment. And now that we're going through the curriculum review, so we've just gone through that process for genomic counselling, and it's happening throughout all of the specialties. It gives us a chance to look at some of those, and for the National School of Healthcare Science also to say, oh, actually now we've got these other professions that are also patient facing. Do we need to adapt some of the structure so more fulfill what we need to for the laboratory and the patient facing roles? And that's quite heartening, because it makes us feel like we're really part of it. You know, we're being considered within what's happening with the STP programme. It's not that we're a sort of interloper.
Shoehorned in because of the interest in genomics.
So that's really helpful, and actually going through the curriculum review process has been really really enlightening from that kind of point of view. Well,
so how are you involved now in the? Are you involved in that the School of Healthcare Sciences? Is that where you fit in? I've sort of
I sit on the theme board for the School of Healthcare Sciences, although obviously it's being covered for me at the moment. And that tends to meet about 3 times a year to find common issues and themes for all across the different specialties. And we've, as I said, just chaired the review of the curriculum development, the curriculum review group. We should have a nice new curriculum that is very similar to the one that we originally developed, with some key changes that we hope will come into play next year, 2022. And some of the things we've been able to do are things that we couldn't do the first time round because we had such tight time constraints. So you might remember that some of the stakeholder review had asked for some extra clinical input, particularly within the first year rotational modules, that gave some of the clinical experience that I think our nursing colleagues and our social worker colleagues and our psychology colleagues tend to get from their practice within healthcare. But actually those people who come from a scientific background or straight from a degree won't necessarily have the exposure to. And so we've been able to incorporate some of that into an additional module in the first year.
Right, that's good.
I think we'll make it a bit more specific. And give some of the clinical experience that those STP students trainees that we've trained since, I think we've probably tried to give them that, but more formalised and recognised within a module, so they'll get credit for that. So so that will be a good addition, and then some other minor changes here and there. Which I hope will strengthen the programme. So, and obviously also as the lead genetic counsellor in the West Midlands, we've been heavily involved in training some of the STP students ourselves, and also we've been really lucky to have some of the graduates come and work for us as well. So that's lovely, because it's nice to see how they've come all the way through and see them start their autonomous practice themselves as their Band 7 genetic counsellors, and also be able to see that they've met the standards, you know, that the programme worked. And that they can come in and they can practice, and while they need the same induction that anybody would need starting in their first role, actually that they've reached the competence level that they need to through the programme.
The programme is fit for purpose.
I think so. I think it's worked really well.
Yes, and of course they have statutory regulation.
And that's quite interesting as well, just isn't it, to see how that fits in with the other regulations we've got, because now it starts to get a bit complicated within the regional centres, that there are people with different types of registration and regulation. But certainly from my experience in our own department, none of that really seems to matter, because everybody's essentially doing the same job with the same set of values. We're able to pick draw on the experience from each other, I guess. In any team, you have some strengths in different areas, don't you? And it's nice to have a breadth of different areas of experience and different areas of specialist knowledge, I suppose, and experience.
I mean, I really wanted to talk to you because it's because of sort of spanning this whole development during my lifetime. You won't know the answer to this, But where do you think genetics is going?
Oh gosh, wow, that's a big question, isn't it?
Yeah. Genomics. We have to use the word genomics, don't
Genomics.
we? Where's genomics going?
Oh gosh, it's hard to know, isn't it? I think I probably see us being at something of a key point in terms of mainstreaming as to where genomic counselling goes. I think genomics itself is infiltrating, for want of a better word. It's becoming quite key, isn't it, in all different branches of medicine, as well as within our specialist centres themselves. And so that has an impact on the roles and how involved we are, not only in providing the clinical service, but in educating other health professionals to provide the clinical service, to provide that liaison and support, which we've always done. Actually, it's going to continue to be a much greater part. So there's an interesting question about how that's going to happen. Is it going to continue to happen in the way that it has in the past, where we're all sort of centrally based in a specialist centre and people dip into what our knowledge pot, or actually are we going to end up spreading out and going working in different specialties, areas, to be able to provide that support kind of on the ground, in situ, at that point in time? And I suspect that that's going to be the case, that actually we're going to end up all concentrated within regional genomic centres. We're going to end up with more of the profession in those other roles. And that's really something that I think probably we need to embrace and facilitate. How we do that while providing the support that we get by all being in one place in a little huddle is probably what we need to work on and develop.
Yes. And
also how we staff that, because we're thin on the ground as it is. And I suspect that if we make some sort of transition so that we can have people more spread into other specialties and other hospitals, that will help us. But there's that point in between when you're trying to do both. It becomes quite hard to navigate. So as leads, we need to work out how we can do that without it being the case that we pull all the staff in and then don't have any to help with. If you like.
And for safe practice and competent practice out there, the professionals have to have a real sense of their professional accountability.
Yeah, they do. And I think to a degree that means we want some of the experience out doing it. And actually happening at the moment isn't so much that, or that's what we need to facilitate a little bit more, rather than it being the case that those roles are being filled by people who geographically need to be in those areas but haven't got a role in a regional genetics centre. Actually, what we really want is some of the experience who know about that accountability and can manage it to go out into those roles. But that's quite a big shift from where we are at the moment.
Perhaps it's where we used to be.
Yes, possibly.
It is interesting to reflect back and think it wasn't, that we think of Taunton. Taunton had, in the end, a consultant genetic counsellor. They don't have one now, but there was that who managed the genetic service down there with a visiting consultant, in a sense. I mean, that's not the model we're going to go to, because that was still about specialist services. But it's interesting how the wheels turn around. They may be slightly different shapes, but it's a constant turning around and development.
Yeah, interesting. And sometimes I think this very centralised model, particularly, so my experience is almost all in Birmingham, this very centralised model has evolved as a way to be able to do the people management. Much easier to do the people management if you're all in one place. You can talk to people, you know what's going on, you can support them from one geographical location. That makes it very much easier from the point of view of managing a group of people. But it's not necessarily the best way to provide service. So whether that's a reflection on the NHS as a whole, that sometimes we do these things because from a management point of view, it makes things easier, but actually we need to think about it from the clinical point of view and what benefits the patients the most, really.
Yeah, what benefits the patients. Yes, yeah. Well, I think I'm up to date.
Okay, great.
Is there anything you want to say, or anything you want to cover that I've not?
Not that I can think of. I mean, I guess I haven't mentioned much in terms of the academy, but that's probably, I'm not as clued up on those conversations within the registration area.
Right.
As somebody who might have been on the GCRB would be.
Yeah, I'm going to speak with Vishaka.
Yeah, so you'll probably get all that stuff.
Her to pick that kind of stuff up from. Yes.
And then I suppose the other people I haven't really mentioned are the kind of key scientists that welcomed us and brought us along. So Annika, Sue Hill, Bell, those people that were heavily involved with the STP programme for clinical scientists already, who were really welcoming and inviting and wanted us to get involved.
Right.
As the profession, that probably feels quite important to represent, as well as ourselves, the key people within genetic counselling. So yourself, Georgie, Heather, Marion, who those people involved in the curriculum development group. Actually, there were people saying, "Come on, come and you're welcome." Michelle Bishop, who had the two, and really was a really pivotal person in getting the programme through, but by understanding everybody's agenda.
Yeah.
There's a lot of those points that you made about what we can compromise on, what's not negotiable for each side, and finding that middle ground so that we can make it happen, I guess.
Yes, I hadn't really thought about the clinical scientist role, but they could have been very unwelcoming. They could have made it very difficult to set up this new branch.
Yeah, or just
not helpful.
Yeah, or there could have been a thought that we were taking funding. Our own posts, couldn't there? Because actually it's sharing it around more people.
Yeah.
But actually there was a very much a sense of being facilitative to try and get more genetic counselling training in place, and that would be a good thing for us to come and join in their route of training, and consequently for us to join the profession of clinical scientists, really. I think there's some influential people from that side too.
Yes, can you mention their names again, because I think they didn't come out very clearly.
Okay, so the likes of Sue Hill and Annika Sella, and Jenny Bell, and then Michelle Bishop, who really helped us in the curriculum development group strike different agendas, I guess, that were going on all through. And Val was the other person, Val Davison. Yes.
I
think that's everybody, isn't it? I'm trying to remember.
I think that's everybody.
That original meeting, it was Sue and Val and Annika, wasn't it?
It was Annika Sella, Sue and Val, yes. And then Annika Sella led the genomics education programme.
But also Jenny Bell in the background, facilitating and helping to translate what was going on with the STP programme as well. Possibly because she is in Birmingham as well, but I used a lot to help me to understand the kind of intricacies of the programme and it could fit. And she was always very positive about the way that she spoke about it. At what was a fairly pivotal time for them as well, because they were adjusting to this new training programme as well. And there were things about it that they knew worked really well. And then there were things about it that were reducing their training numbers. So she helped us to see that actually it could still work, even if there were some things they were still sorting out and developing for themselves.
Yes. Has the new training programme, from your experience, has it actually because again, reflecting again, at the beginning we worked so closely with our laboratory colleagues, you'd have weekly meetings, everything was by link, family studies by linkage, so you were constant, conversations about which blood sample you needed, which family member, all that kind of stuff, and what the results meant with the haplotype analysis. And then, of course, it became more routine. It became more just ordering the right test and getting it back from the lab. Has it helped with a sort of bringing a more interdisciplinary approach again between the laboratory scientists and the genetic counselors, do you think?
I think so. Some of that, it represents a time of massive growth for the lab, doesn't it?
Yeah.
And so, particularly in big centres, I'm sure this will continue to be the case in the future as we've moved into GLHs. You can't know everybody in that laboratory in the way that I suspect you did when you had lots of conversations. When I started, we were having regular meetings, but the lab's probably more than doubled in size since I started. But I think what's really nice about the format of the STP programme is that our trainees go and spend some time in the lab. And so they develop those relationships, even if they can't meet everybody. They develop some understanding and some relationships. And also that those scientists come and spend time in the clinical department. And it's formalised and it's credited. So it's not just that they come and sit in the clinic. And you're lucky if you happen to be the person that they sat in the clinic with. So because you then know them in the department for a few weeks or a few months. And so they meet a lot more of you and understand more about what you do, and you understand more about what they do. The relationships and the liaison, I think it really helps. Hopefully, the way that we're moving to work as GMS alliances will help to support that continue. Because MDTs are much more now involving our genomics clinical scientists and our bioinformatics clinical scientists and our cancer genomics clinical scientists, as well as our genomic counselling ones and our consultant geneticist colleagues as well. So it feels much more multidisciplinary just from a genomics point of view, as well as being multidisciplinary in terms of our mainstream colleagues.
Yeah.
Hopefully that will continue to support that interaction and liaison.
Yeah.
We hope.
It's really exciting, isn't it? It's going to be hard, but it's really interesting to see how it turns out from a distance.
Pop in with your insights, Chris.
Yes.
I think that's what is really kind of helpful and influential from you and from other people that have seen this evolution come through, the revolutions and the evolutions, to be able to say, just point out that key piece that we might otherwise be missing, and to remind people that we've come through it before. Sometimes when you're right in the thick of it, you can just feel like there's so much change happening and so much that you're trying to facilitate, that it's not possible to do it all. And it's helpful to have people to go, but we managed this and we've come through that, and actually it is possible to, and we will come out the other end of it.
Yes.
With an improved service.
Yeah. Yeah. And that's for me, it's about the service to the patients, which are now not only the rare disease patients, but all the patients where genomics is part of their care. And for some of us, that will mean us not doing it. I mean, specialist genetics not doing it.
Yes, the things we need to learn to let go of.
Exactly. And we've done that before as well. We have let go of that before.
Yeah. And I suppose people tend to find that a bit frightening if it's their kind of mainstay of what they used to do or what they currently do. They're letting go of, and something else that they've got to embrace, because actually it's much harder to do the things you're not super familiar with. It's much easier to keep doing the same thing again. It doesn't require quite so much prep, does it?
No, it's much thought.
But it's also the interesting stuff, it gives us the challenge that actually is what we enjoy often.
Yeah.